there are many things you have to look at as a healthcare provider. So that's why it's always a journey of learning and relearning as healthcare providers. We cannot assume that paternalistic role that the older doctors used to have,
Yes.
where they were always right and they were
Mhm.
always what they say is law.
Yes.
That's how it used to be, Cindy. And some of them
Yeah,
were still
that's true. That's very true.
and trust me, the way I approach my patients now is very different. And that's probably why across board, I get patients who tell me, hey, you're the first doctor who's actually listened. And I've heard that in Kenya and I've heard that here. So it means that's why I was telling you, patients want somebody who can listen. Because when you listen, then
Yes.
you understand what their concerns are. You'll be able to tell, oh,
Mhm.
this one, the concern is money. So whenever I write my medication, I should make sure I take care of that. Or this one, the
Yeah.
concern is depression. So I should not just write anything. Do you know beta blockers, for example, would worsen depression?
Mhm.
But we write beta blockers for everybody. We don't remember that if you have a depressed patient, perhaps a beta blocker might not be the best choice. It might be indicated, but go slow on it. So we have to always kind of build our knowledge so that we can do better for our patients and treat our patients with empathy the way we would want to be treated. I have seen healthcare providers who have locums in private sector and public sector.
Yeah.
The way they treat
Yeah.
patients in the private sector is very different from the way they treat the public ones, which breaks my heart.
Mhm.
Just because somebody doesn't have money doesn't mean you should just, not listen to them or feel like they have nothing to, there's a certain way in which they are taken, which I think is wrong. So healthcare providers, we have a long way to go. We have to be better. We have to read. We have to, make ourselves more knowledgeable and look at the patient holistically. That's why what I love about you saying, like, you don't just look at their perspective of the disease. You want to look at what's behind the disease. Yeah, you want to dig deeper. So we all have to try to do that.